Grand River Community Health Center has helped me to be a better person than I was the day I came.
It's a great place to be, and I didn't realize just how much it was important to people.
Grand River Community Health Center is a healthcare service. It provides primary health care, similar to you get at family physician offices and also through nurse practitioners. But what makes us a bit unique is we incorporate health promotion and community development as part of our mission. Health promotion is increasingly embraced in all models of healthcare and primary healthcare. Community health centers in Ontario have been doing that for especially a long time, and probably the community development approach is more important to us. We look to improve health for certain populations, certain communities, certain populations that have faced disadvantage over the years.
Community health centers are here to help build capacity of individuals, of our clients, of our community, and that's what makes community health centers different than other health service providers. So we work on social determinants of health, which are the various areas that make communities and individuals healthy, such as education, food security, housing, income, and so on. So this is our focus, and this is what community development and health promotion does. We focus on those areas to help build capacity and health of our community.
And your name?
As a client at the Grand River Community Health Center, you can expect to be greeted with a smiling face, to have access to many of our community resources and groups that are being offered at the center, have your primary care needs met, and really our healthcare team here is a solid team of people from all different backgrounds, all different walks of life, who are very understanding and compassionate and empathetic, and who are here to provide the best care possible for the Brantford community. When a client gets diagnosed with a medical condition, there are various aspects to the appointment and the follow-up schedule, which are really personal to that client and their healthcare needs. Oftentimes we can refer them to the dietitian here, the social worker, the outreach worker if they have any housing needs or questions about navigating government agencies or things in the community. And as well, we bring them back with our nurses as needed and with their primary care provider for close follow-up. And it is all very tailored to the patient's medical history and current medical diagnoses.
The clients really appreciate the services that are offered at the health center, and sometimes actually they see the physicians or the MPs and they don't actually know about a lot of the services that are offered here. So I've been able to bridge those gaps.
The Grand River Community Health Center, because we have such a variety of healthcare providers, experts in their fields in the same building, we're able to coordinate and collaborate more effectively than if we were in our individual silos. In particular, we have what are called complex care team meetings, where members of the interdisciplinary team come together to talk about clients and how we can best meet their needs together.
We know that it is important to keep people out of the hospital, and by doing so, we incorporate different members of the care team into their care plans. So that would be social workers, outreach workers, community supports, nursing supports in the community.
We serve such a range of populations, the young, the old, the disadvantaged, the average citizen of Brantford. They all have a story to tell.
I go to the Stitch and Chat. It's a ladies group. We deal with each other's lives and problems and just something a community needs that not all of us have someone to go to. So we come in here. And across from the Stitch and Chat is a courtyard, and I take care of that. In the garden there's herbs that are grown that they use for vinegars, oils, things here that they teach classes to.
I do a variety of cooking classes, including teaching people how to do basic kitchen skills, food safety, learning how to cook for one person, as well as learning to cook as a whole family.
I volunteer here with the Refreshment Cafe. I also do crafting classes, sewing stuff, and making dream catchers and wreaths and stuff for the gift shop.
A group was running here at the Grand River Community Health Center. It was called the LGBT Coffee Social. And so I showed up for that, and they had a change group, Gender Journey Brantford, and I needed to come to that. I needed some peer support.
I assist the community in building their capacity to solve their own issues and organize the community around them to support that. And I think it's very important for people and individuals and groups to get their power back and also to advocate for themselves. I really help with social justice issues that are happening. If there's various communities that feel a certain degree of oppression or discrimination, or if there's issues around homelessness or food insecurity, I assist in trying to solve those issues.
Some things that we've seen since the launch of the health center, more partnerships with other agencies working to improve the health of a population. Health equity talks about those inequitable differences in people's health. And the health center tries to address these upstream factors. And those upstream factors could be trying to address precarious housing, precarious employment. How do we develop healthier relationships with friends and family so they can provide support to us? Do we start healthy eating habits earlier in life? And these all have downstream impacts and help us address the challenges we all face in our health. We're celebrating 10 years of being in this community, being connected to this community. It's a privilege to serve community members.
I think it's a lot more important than people really realize. I don't think that a lot of people know what's here, what you can be involved in, that you can make new friends, that a lot of people are afraid to come to places like this because they're afraid of being judged. This is not like that.
They're very friendly. I'd say they're a lot like your own family.
There's not a lot of safe places for people in the LGBTQ2S+ community, so when we come here, we know everything is going to be fine.
Everybody needs a place to go where they can feel safe, comfortable, and loved. And this is the place.